All right, we're going to start the Gallatin County COVID-19 press call. Today we have on the call Lori Christenson, who's the Gallatin City County Health Officer. We also have Kallie, Kujawa, who's the Bozeman Health COVID-19 Incident Command Lead. We have a special guest today, Dr. Kerrie Emerick, who's a pathologist from Bozeman Health. And MSU is doing their commencement today, so they are busy. If you have any questions for them, you can contact Michael Becker directly from his email. I'll hand it over to Lori.
Great, thank you so much, Holly, and welcome everyone. Again, my name is Lori Christenson. I'm a health officer for Gallatin County. I'm going to go ahead and start off with our weekly surveillance report. And I was just sharing with Holly that I'm having a little hard time with screen share today, so hopefully I won't bumble through this too badly. All right, so confirming, Holly, that you can in fact see the surveillance report.
Yes, we can see your screen.
Excellent, thank you. All right, so this is our surveillance report for December 17th. I'm going to start off with our first figure here, which is the daily and 7-day average of cases per 100,000. As you can see, we are continuing that decline, the decrease in number of cases we've seen over the last couple of weeks, which is a great trend. Specifically, the 7-day rolling average of daily cases per 100,000 residents was 20.1 cases per 100,000, which is a 26% decrease from where we were on 12/8. Similarly, our daily and 7-day average of percent positivity has also continued to decline. We have seen a slight decrease in the number of testing, but nothing concerning to where we would look at the percent positivity and have any concerns about whether we were testing enough. So we are below that 10% threshold. So again, that's this red line here. And so our 7-day rolling average of percent positive was 6.3% on 12/14, which is again a decrease from the previous week. Still are seeing a really great turnaround time from specimen collection to reporting to public health. And in terms of our number of cases by vaccination status, over here, week 49, again, this is MMWR week 49. The majority of individuals, of cases are amongst those who are not vaccinated. We continue to see some breakthrough cases, and that's represented here in the blue. And for COVID-19, hospitalizations, again, the orange bar here indicating these are the individuals who are not vaccinated versus the blue bar indicates individuals who are vaccinated and hospitalized. Moving on to vaccine summary. Again, when we see these kind of bolded numbers, this represents a 1% increase in this particular age group. And we continue to see, again, the 5 to 11-year-olds, we continue to see vaccine uptake in this group, which is great. That's makes a lot of sense given that these young ones were just recently eligible for vaccine, but we are seeing movement in all age groups, which is great. As well as being followed up by being fully vaccinated, which is key to full protection. We have 16%, again, won't go through each number, but you can see that we've at least had a 1% increase in many of these age groups for being fully vaccinated. These are our data for our school cases. And I do want to just remind everyone that while we are seeing a decrease in total number of cases, we're continuing to be in high transmission. So that recommendation from CDC that we share with all of you is that if you are, whether you're vaccinated or not, you should be wearing a mask in indoor public places. So I'm going to stop sharing my screen now and talk a little bit about our testing. So this weekend, we will be pivoting away from our free antigen testing available at the Gallatin County Fairgrounds. This weekend will be the last weekend we'll be providing that service. That is in part because of staffing resources as well as inclement weather, and then also just kind of a decrease in the number of individuals who are seeking that particular site for testing services. That said, we still believe that early detection and having good access to antigen testing and free access to some of those testing resources remains vital in terms of slowing down transmission. So we're pivoting to a slightly different model where through a supply we have through the Department of Public Health and Human Services, we are setting up kind of distribution points throughout the community and locations really to serve and address barriers to accessing testing. So individuals who maybe have transportation issues or have fear of cost or cannot afford or feel like they cannot afford a test. We want to make these tests available to try and reduce those barriers for individuals. So we're working with a couple of locations to provide, again, these over-the-counter at home. They're going to be Binax Now tests, accessible in basically these points of distribution. And again, I just want to reiterate, there are a variety of testing resources available through Bozeman Health, through providers, and you can also order a lot of these at-home test kits online or in some local pharmacies. These tests are really meant to be accessible to those who may otherwise not seek testing because of barriers. So a little bit more information will come out related with some additional details. We'll be sending out a press release related to that later on today, but I wanted you guys all to know now. And then the last thing that I wanted to speak to was, I'm going to pivot and talk about the influenza a little bit. So this is where I'm hoping my screen share will work. All right. Which, let's see.
So we see your notes page right now.
Yes, and this is fine. I just don't. Okay.
There you go. That works.
Okay. All right. So right now for the 2022 influenza season, we've had a total of 128 cases. The median age for those cases is 20. And this is a little bit blurry, I'm sorry for that, but we are tracking those cases by MMWR week. And you can see that we've had a bit of a uptick here in week 50, which ends actually on the 18th, so that'll end tomorrow. But we are seeing, you know, a pretty good increase in the number of cases of influenza here in our community. And I just want to take a moment just to remind the community that the flu vaccine is available. Just like COVID-19, the flu vaccine does provide a very important level of protection, as well as the other respiratory hygiene that we've learned along the way this past 20 plus months, where it's really important to wash your hands, stay home when you're sick, and seek medical attention. So I wanted to just bring some awareness around this and just make sure the community is aware that there are other respiratory illnesses and viruses that are circulating in our community, and influenza is one of them right now as well. So with that, I'm going to stop sharing my screen and I will turn it over to Kallie for a Bozeman Health update.
Excellent. Thanks so much, Lori. Can you hear me all right? Okay, great. I'm on a little different computer today, so I have to test that out. All right, so as Holly said, I'm Kallie Kujawa. I'm Bozeman Health System Director of Quality and Safety, and I'm our COVID-19 Incident Command Lead. As always, I appreciate you joining us today. Currently, we have 8 COVID-19 positive patients at Deaconess Hospital. We have no COVID-19 positive patients hospitalized at Big Sky Medical Center. And our critical care unit at Deaconess Hospital has 20 beds and is currently at a 95% capacity. 5 of the 19 patients in the critical care unit are COVID positive, with the remainder being other healthcare needs. Additionally, our medical unit is at 97% capacity, and our surgical unit is at 89% capacity. We have 3 COVID positive patients on our medical unit today. We are more than 6 weeks into being able to help protect children ages 5 to 11 with the Pfizer COVID-19 vaccine. And to date, we have administered more than 3,500 doses to children in that age range. That's almost 2,300 first doses and almost 1,500 fully vaccinated kiddos in that age range, which is phenomenal efforts there. Starting on Monday, we are moving our vaccine clinic at Deaconess Hospital to entrance 4. The hours and information are posted on the Healthy Gallatin website, as well as the Bozeman Health website. Switching gears just a little bit, I wanted to acknowledge a huge thanks to the generosity of the Big Sky community. I'm pleased to share that Big Sky Medical Center now has a Panther PCR analyzer. And so they are able to collect and process PCR COVID-19 testing with next day turnaround in the Big Sky lab. Big Sky Medical Center now also has COVID-19 travel testing available as well. So travel testing requirements, they continue to adjust depending on the destination of travel. So please make sure to do your research and get your travel test at the appropriate time with the appropriate test modality. And then as the holidays are nearly here, vaccination, masking, hand hygiene, and social distancing, just as Lori mentioned, are just as important as ever. And we just want to reinforce the use of those so that you can do everything possible to keep yourself, your families, your friends, and your colleagues safe and healthy. And then as Holly already mentioned to you, we do have Dr. Kerrie Emerick on here. She is a pathologist and she is the director of our lab. So she'll be here to answer any questions, and I'll also open it up to you, Dr. Emerick, if you had anything else you wanted to add.
I don't have anything in particular to add. Just like Kallie said, we do have the Panther. It's up and running at Big Sky. I think it went live maybe on Monday or Tuesday, and we're able to do high throughput testing there and not just onesie, twosie tests on a PCR analyzer. The turnaround time is about 3 hours, but we can accommodate a lot of volume on that analyzer, which is really nice. And I'm happy to answer any questions that anyone has regarding testing.
Yeah. Thank you, Dr. Emerick.
All right, so with that, why don't we open it up to questions from all of you?
Hey guys.
Hi, Juliana. I wanted to make sure I wasn't on mute. I thought, well, maybe I did.
No, I'm just taking my dear sweet time. I'm curious, when you were talking about staffing shortages for that antigen testing, Lori, if you're able to kind of say in more detail with that, how many people you would ideally need and how much of a factor that was in
Yeah,
closing that.
thank you for that. And really, I should have been more articulate when I shared that it's really the main reason why is just it's really hard to maintain those sites in the winter time because it is a drive-through site. And so that was really kind of one of the main reasons for that, as well as just seeing a little bit of a drop in and demand for that, and trying to be more creative in how we're providing some of those resources out into the community and further out into the community. So staffing definitely was a piece of that. It wasn't a main factor. And really, you know, for us, it was more of those other factors that played into it.
I guess this question is for anybody. Overall, are you all seeing kind of a decline in demand for testing? And do you expect that might go up with, you know, people traveling for the holidays?
I can speak a little bit to just in terms of general numbers. In our surveillance report, I just briefly mentioned that we're seeing a little bit of a drop in the number of individuals who are seeing testing, but certainly not a precipitous drop. We continue to see individuals who are seeking testing. And I can certainly turn that over to Kallie or Dr. Emerick for a little bit more information.
Yeah, Dr. Emerick, do you want to speak on that?
Sure. It seems to me that testing, the number of tests has stayed pretty stable. Like Lori was showing in her graphs, the number of positives for the testing has decreased a little bit, which is nice. But I think we're a pretty steady state on the number of people who are coming through the drive-through tent and going to our other sites like Main Street Urgent Care and Belgrade. There might have been just a slight decline in the number of tests that we've performed, but for the most part, I think it's pretty stable. As far as expecting an increase after the holidays, we are aware that that might happen, and we're fully prepared to accommodate that.
Awesome. Thank you, guys. I guess my only other question, we've been seeing cases kind of increase, nationwide with the Omicron variant. And I know we don't have that yet in Montana, but I'm wondering if you guys are preparing for or expecting to see kind of an increase in cases if that variant arrives, or just kind of generally with the holidays as well.
Yeah, Dr. Emerick, do you want to speak a little bit on what you're seeing or what your thoughts are with the Omicron?
Yes, I'm happy to. Just from what we know, which is very preliminary data, the Omicron variant is more infectious than the Delta variant or the original COVID-19 that we dealt with in the last 2 years. And so once it does hit Montana, I expect that our COVID rates could increase because it, from what I've been reading, it's about 70 times more infectious than the other variants of COVID. The good thing is, at least preliminarily, the disease tends to be a little more mild. But one thing we do need to watch out for is that it is, at least in South Africa, has affected more young people. So I think it's important to continue to get those young people vaccinated.
And I'll just add a little bit to that. We as a health department, as a county response, when we work with Bozeman Health and our partners at MSU, none of us have a crystal ball. We wish, many times over this course of the last couple of years that we did. So, we are kind of always in planning mode, thinking through like, what's our contingency plan if we do see another spike, and anticipating and planning around that possibility. And so really, I think as a community, we're well posed with having the access we do to vaccines and the continual access to vaccines. And we'll continue to stress the importance of being vaccinated and getting your booster. And then, we'll continue to support testing and testing resources and making sure people have access to those, complementary access that, again, Bozeman Health has just spoken to and other providers do. Just as a whole community response, we're always sort of trying to think ahead and get ahead as much as we possibly can for what could be coming in the next few months. But no one has a crystal ball. It would be nice sometimes.
Thank you, guys.
Yeah. Other questions?
Hi, this is Emma with NBC Montana. Can you hear me?
We sure can, Emma.
Awesome. So I missed like the first 5-10 minutes of the call. So I apologize if you hit on this already. This also kind of plays off of the last question and what you were just talking about. But more specifically, when it comes to just potential rises in cases, or I should say more potential community spread. We obviously have Christmas in a week, but we have some big events happening in the county, like the MSU playoff game tomorrow. And so I know you talked a little bit about testing, but could you speak just a little bit more about for the health department, if there's anything you're looking out for, any recommendations to the community if they're going to be gathering in some of these events or spending time or traveling for the holidays in the next 2 weeks?
Yeah, sure, absolutely. I'll kick it off, and if Kallie, you want to chime in, or Dr. Emerick, please do. So our recommendations will continue to be really focused around identifying ways in which you can be as safe as you possibly can in those situations. So wearing a mask is a great tool that we have available to all of us. Wearing a mask is a good protective and an individual protective option for many of us, as well as staying home when you're sick. So if you're not feeling well, as Kallie mentioned earlier, maybe stay away from that gathering. Don't go to a friend's house for dinner if you're feeling sick, or go to work where you may be inadvertently exposing others in those settings. So seeking testing will really help to make sure you can identify if it is COVID-19 or other respiratory illness. We don't want to spread any respiratory illnesses to our friends and families and coworkers. And then again, just continuing to reiterate, especially when you're traveling, to know where you're traveling to, what the requirements are for traveling, and just identifying your risk factors in your particular situation. Are there opportunities to gather differently in a setting, and just having those conversations with families and colleagues around the holidays, I think, is important. Kallie, what would you add to that?
No, we just reiterate, I would just reiterate exactly what you said, Lori. As we know that there are many other viruses circulating right now, influenza, RSV, lots of other respiratory viruses, that it's important right now more than ever in this season to be washing your hands, trying to practice social distancing. We know how important it is to connect and gather with others. So don't go near others when you're ill, and using that mask, I think, is really important. Vaccination is an excellent way to prevent spread as well. So both influenza vaccine as well as COVID-19 vaccine. And we have a lot of availability through our primary care clinics and through some of our other clinics for you to get an appointment for your COVID-19 vaccine if you haven't already done so. Getting that booster also is really important right now. And then making sure that you've got your flu shot as well. So Dr. Emerick, would you offer anything else?
I don't think so. I think you guys have covered it. I don't know how what our flu vaccine rate is at the hospital, but I think typically people do get vaccinated, and if people in the community would go ahead and do that too. I think it's maybe a little bit early to know how effective the flu vaccine is, but what we've been seeing mostly at the hospital is influenza A. I think we've had one case of influenza B, and then maybe 2 days ago on Wednesday, we had 20 cases of influenza A in Bozeman Health that we diagnosed. So I think it's really important right now to get your flu shot if you haven't had it, because we're entering flu season and it's going to hit us. So if you haven't done that already, that would be a good idea.
Emma, that was probably
Great. Thank you guys so much.
I was gonna say this may be a lot more than you were hoping for, but hopefully collectively.
No. That was perfect. I'll always take more of a long answer than anything at all. That was great.
Okay, thank you. Other questions out there today?
Hi, everyone. Olivia with YPR. I just had a question about vaccines for kids. Just wondering, I remember kind of earlier on the school year, there was a vaccine clinic for kids. Just wondering if you could touch on what kind of current opportunities and places there are for 5 to 11-year-olds, and then kind of what you've seen as far as vaccination rate trends among that age group.
Sure. So was your question, the first part of it was the school clinics? Can you repeat that part again?
Yeah, I just remember there were some clinics earlier on, but just wondering if you could kind of touch on what are some of the current opportunities and places where kids in that age group can get vaccinated.
Yeah, so specifically for 5 to 11-year-olds, I can speak to the vaccination effort that we have in partnership with Bozeman Health, and then Kallie, if you want to expand on that a little bit as well. But we offer multiple days of the week. We have opportunities for individuals 5 and up to receive a vaccine, whether it's your first, your second, or your booster dose. And those times and dates are on our Healthy Gallatin website. And we're proud to have been able to offer that on a really consistent basis for a number of weeks now. So we could have, a consistent place where individuals knew and could easily make an appointment. There are other providers throughout the community who are also offering the pediatric Pfizer vaccine. And then specifically, Kallie, if you want to talk about efforts within the Bozeman Health Peds, I think that'd be important.
Yeah, great. So we offer COVID-19 vaccines as well as influenza vaccines at provider visits. So if we have pediatric patients who want to see their primary care provider, they can receive it in office as they normally do with their other vaccines. And that's at our neighborhood care center out at Cottonwood, as well as in Belgrade and on the Deaconess campus in Bozeman. In Big Sky, we have a particular day a week where it's dedicated towards those kiddos, so they can have access on those days. And there is efforts being coordinated with the school. And I believe more information on that specific age range. Thank you, Lauren. She's going to list that right there for me. So some good information that spells out for that age range on what the opportunities are is right on our website. But they can absolutely fold it into their pediatrician and their primary care visits with their family practice physicians if they'd like to do that.
And then Olivia, I think you had another question in there too with regards to the trend we're seeing. Is that right? Right. Okay. So we are, let's see, let me pull that back up in our surveillance report because I don't want to misspeak. All right. Hopefully you can see the surveillance report now. Thumbs up, everyone. Okay, good. All right, thanks. So for our 5 to 11-year-olds, we continue. This indicates a 1% increase in our 5 to 11-year-olds. So we continue to see this age group and a couple of the other age groups seeking a primary, their first dose, and then following that up with their second dose. So we continue to see good uptake, at least initially. We hope that trend will continue, where additional kids will continue to see receive their first and second dose. So we've seen at least a 1% increase over the course of the last few weeks. That helps answer that question, Olivia.
Yep, thank you.
Yeah, perfect. All right, other questions out there today? Okay, well, seeing none, we'll go ahead and close this opportunity, but I wanted to say thank you again. We will be sending out a press release with a little bit more information than I shared today, just because we're still gathering a lot of the points of that distribution plan. So we'll be sending out that information to you shortly, so you can have that. And then unless there's a reason where we need to come quickly back out to all of you, we will not hold a press call next week. However, we will provide you a surveillance report, and we'll do that via email, as Holly has been sharing. So I just want to take this opportunity to say thank you for your support, and I hope you and your families all have a very safe and healthy holiday season. So with that, we'll go ahead and sign off. Thank you so much, everyone.
Thank you.
Thank you.